audience, if you can see everybody. Okay, so this is about the Death with Dignity Act. I will prescribe regimen for the good of my patients according to my ability and my judgment, and never do harm to anyone. To please no one will I prescribe a deadly drug, nor give advice which may cause his death. That's the Hippocratic Oath. That's just a piece of the Hippocratic Oath that medical students recite during their white coat ceremony. The oath has been recited for centuries when receiving their medical degree, and was disrespected when one state passed the Death with Dignity Act. On October 27, 1997, Oregon became the first state to pass it. The U.S. fought and won their right to freedom, but with that freedom comes great responsibility. In 1997, the U.S. Supreme Court ruled that the Death with Dignity Act is not constitutionally binding. In a decision written by the Chief Justice William Rehnquist, the court rejected the idea that the right to assisted suicide was a fundamental liberty interest protected by the Due Process Clause. The Death with Dignity Act is allowing people to give up too soon and allowing doctors to give up on their patients. Today I'm going to explain what it is, how I first heard about it, the qualifications to be approved, and why it should be illegal. The Death with Dignity Act allows terminally ill patients to use a prescription of lethal medication from their physician to self-administer at the time of their choosing. To be terminally ill is to have a disease that can't be cured and will cause death. It was in 2014 when I first learned about this. Brittany Maynard went to the public and with her decision to end her own life. And according to N.W. Egan, doctors told Maynard that she had 6 months to live last spring after she was diagnosed with a likely stage 4 glioblastoma. She was offered both chemo and radiation but rejected them due to their possible side effects that she might have, and she quickly declared that the Death with Dignity Act was her best option. According to Healthline.com, the median survival time for a glioblastoma is 15 to 16 months, and people who have had surgery, chemo, and radiation. But everyone is different. Some have known to survive 5 or more years, and new treatments are extending this, like immunotherapy, which is using your body's own immune system to kill cancer cells. Gene therapy is being used to fix a defective gene to treat cancer, and vaccine therapy to strengthen the immune system. The eligibility requirements are really simple. You need to be 18 years or older, a state resident of California, Colorado, the District of Columbia, Hawaii, Oregon, Vermont, or Washington. You need to have a decisional capacity, which means you have to be mentally competent to make your own healthcare decisions. Be able to self-administer and self-ingest the medication, so no tubes or anything to administer the medicine. Able to make 2 oral requests at least 15 days apart for a life-ending medication, and written requests can be made by a patient who has been informed of the effects of the Death with Dignity medication and of the alternatives to the Death with Dignity medication. So they need to have 2 doctors to determine whether or not this criteria is met. The patient submits 1 oral request for the medicine. They wait a minimum of 15 days to submit the second one. They can rescind the request at any time, and I have read some about some of the terminal illnesses that have applied for this, and some people just have kidney disease, which someone with kidney disease was given 6 months to live and weren't given many tests to determine how in-depth their sickness was. And people can live for years on dialysis while awaiting a transplant, and those kidney transplants are the most common transplants in the U.S. So why should the Death with Dignity Act be illegal? First of all, it violates the oath that every doctor takes during their white coat ceremony. Some people say it could reduce healthcare costs, but how can that determine human life? Not saving a life or giving up too soon is demeaning, because some people do not get to make this decision. It's made for them. Insurance companies are always looking for cheaper ways for healthcare, and encouraging doctors to pursue this path for patients should be illegal. Opioids and benzos were created to relieve the pain and suffering for those who need it. They are now being abused worldwide. So who's to say that these doctors won't start abusing the act? Doctors that are pro-Death with Dignity Act are failing to be advocates for their patients. They are failing to fight for them and failing to do their jobs. For the past 6 years, I have worked on a trauma stroke unit, and for the past 6 years, I have seen some horrible injuries, but I have also seen a lot of miracles. Some of them were considered terminal. Some were told they would never wake up. Some were told they would never walk. They would be wheelchair bound or bed bound for the rest of their life, and I have seen some people that have recovered from all of the above. Those that usually do have a fighting spirit and encouraging family members. My point is that doctors should encourage this in all of their patients. They should first do no harm and realize that with all the advances in medicine, there could be one for any one of these diseases for the patient tomorrow. So imagine being told that you have 6 months to live and your condition will probably get worse. Now imagine yourself 6 months from now, a fighter, a survivor, defying the odds and proving your doctor wrong. This happens every single day. All patients should be given every option to fight and should be encouraged to do so. A doctor should never assist a patient in taking their own life. Doctors who partake in this have violated their moral and ethical codes to first do no harm. And that's all.